Hello, everybody. Welcome to HBMA Live again. It's a bright, sunny day here in Tampa, Florida. But I'm very excited because our workshop, our conference for HBMA is coming on March 30, 31st. And it's going to be in New Orleans this time. March 30, 31st at Royal Sonesta Hotel. Now you can register, you can still register for it. We still have some slots open. It's on www.hbma.org. And with this, I'm also very excited to invite one of our guests who's actually a CEO who was a CFO and got promoted to a CEO. His name is Matt Rolfe, and the company name is MedEvolve. And I was reading about that company, and I met the leadership in last conference. I was so excited about the technology and the product and the service, how they have combined it together to help RCM automation. It's not only a wonderful product for medical billing companies, but I guess it is a great product for medical groups. I had a brief conversation with the CEO a few minutes ago, and it seems that we are going to have some amazing fun in today's session because he comes with a background of mergers and acquisition. He comes from the accounting background. He was a controller of Streamline Health prior to MedEvolve. And in that, he led the company for accounting and reporting functions through a time of significant growth, including the planning, integration, and reporting on two different strategic acquisitions. So he's a perfect candidate if you or anybody whom you know who's planning to take the company to public or bring an IPO or scale your company in medical healthcare tech field. This conversation is going to benefit you a lot. Without reading his bio in detail, because I know Matt Rolfe would be talking about himself and his ideas, what we can do in healthcare innovation side, you would really like this interview. So with this, I'm happy to invite my friend, Matt Rolfe. Welcome, Matt. Welcome to the show.
Hey, everybody, thank you. And thank you for having me today. I appreciate it.
So I know that was a little confusing this time because we had two simultaneously conflicting schedules going on, but I'm so happy to see you finally on the show. Welcome again.
Yes, thank you. Again, yeah, thank you for having me. I appreciate it.
So I was reading through your bio, and I saw that you started your journey pretty much the same time I started in this, in this country 18, 20 years ago in healthcare field, and you stay focused on healthcare field. Because your background was accounting and reporting, you could be instrumental into bringing any company, and you could be really, working in any company. Mm-hmm. What made you think about just to stay focused on healthcare? What was the motivation behind it?
Yeah, I mean, just, for me, just, even as a kid, always liked looking at things from a problem solving perspective. Getting into healthcare at Streamline, really in the acute space, and seeing just kind of how much inefficiency and just kind of, waste and cost was going into the, the administrative side of healthcare. There was just a lot of opportunity, I thought, to kind of make a difference there. And transitioning into MedEvolve more in the ambulatory practice space, all small businesses, again, something that I have a passion for, again, growing up in a small business, as a child, really saw an opportunity there to really help practices to, like you said, scale, grow, if they're looking to acquire practices, in their space, and just generally grow their business, whether that's organically or inorganically. I think there was an opportunity, there still is an opportunity, and the products that MedEvolve has created over the last 3 or 4 years, I think really kind of speaks to kind of the direction that we think healthcare is going, which is further consolidation, practices joining up, gaining market share, those types of things. So we've positioned ourselves well, I think, to take advantage of that market.
So it is so It's an amazing feeling to be in healthcare. I can feel it. I can see it. It vibrates with everybody because everybody needs healthcare. Good healthcare requires good people, and good people requires good tools, and good tools require innovation.
Yes.
So healthcare technology is always, growing field. What difference do you find in last 18 years, evolution of this field, and how do you personally cope up with the change in your leadership roles?
Sure. So, I think the biggest change is who is paying for healthcare,
I
right?
like that. I
Because
like that.
we have, I can't say that I paid for my healthcare 20 years ago, but from what I
Right.
know about it,
Right.
the mix of who's paying for it was more heavily
That's
weighted
the
to
key.
the
That's the
insured,
key. Yeah.
right? So with high deductible plans, we at Medivol have a high deductible plan here ourselves. So, we know that the consumer is responsible for more of their share of the healthcare cost. So, one of the things that we've tried to do was to obviously make the billing process more streamlined, more efficient, more accurate, those types of things. So, I come to get my health care, they file my insurance, hopefully things pay without any issues. Um, where we've tried to bring some innovation is on the patient engagement side, right? So communicating better with the patient up front, point reminders, all the prepayment tools, those types of things. We have surprise billing laws that are coming down the pike here, currently, and probably more so into next year. But finding ways to engage with the patient more on the front end, to secure payment if there is going to be a payment, right? But also on the demographics insurance side, and making sure those things are done right on the front end, so that we're not having to deal with it in the accounts receivable in the back end, right? Because once it goes to accounts receivable, we're spending money on following up on that AR. So as much as we can build those tools, make it more efficient, more accurate on the front end, I think overall, whether you're in the acute setting or you're in the ambulatory setting, it doesn't matter, right? You want to make sure that you're engaging with those patients the right way to get the right information on the front end.
So what do you mean by when the right engagement and the payment? So tell us a little bit. What do you guys do?
So, we try to, again, look at the schedule coming for the next couple of days here, and making sure that we allow allow the practice to see who is coming in that schedule and who hasn't been
Right.
financially cleared.
Who wasn't bid?
So,
Okay.
so we're managing exceptions, right? So the normal process, everybody should be cleared. Your
Right.
demographics and insurance information should be correct. If for some reason we see, Matt Rolfus is on the schedule for tomorrow and he hasn't yet been financially cleared, we want to make sure we bring that to the surface so that the practice can engage with Matt before he shows up.
And what do you do after that? And I'm sure there's an automation process to that.
Yeah, so really the identification of it is the automation, right? Because if we can look at the patient account and we can see that Matt Rolfus's insurance is ineligible, we need to call him and figure out what insurance he does have, and obviously if we take that.
Also, you guys have people and you provide people with
Yes,
the
we can.
technology. So you guys make a call and attempt to collect the payment before. Oh,
whether that's us, again, we use the same technology our practices use.
Correct.
So whether we're making whether we're making the phone call or they're making the phone call, it's still the same technology that's looking at the account and saying, I need to work with this patient or I don't. Right.
Correct.
We want to manage exceptions, not just the stuff that should flow through naturally.
Right.
I think things like surgery estimation is important.
Right.
So if you're a family, you're a middle income family, you have a $10,000 deductible, and I need a knee surgery, and that knee surgery is going to net cost me $4,000. I mean, $4,000 to an average family is a lot of money. So I think it's important to engage with them on the front end financially, so that they understand what they're getting into and that they can budget for that surgery, because you have car repairs, you have any kind of school issues, where that might be. It's important, I think, to be transparent with the patient up front and allow them to understand what financial responsibility they're going to have.
How would you plan? Because I see training as a huge challenge to these kind of things, which are people oriented. It's like you have to train constantly, thousands of specialties, thousands of practices, different financial systems, practice management systems. How do you manage your training mechanism in the company? How do you make sure that every client is
right?
Because think about it. Single practice company, doctor's office, they are not able to do it efficiently. That's why they call you.
Right.
Now you're managing multiple offices, multiple practices. What's the secret sauce?
Sure. So, I think it comes back to MedEvolve's people, right? I mean, we want to hire the SME knowledge and the subject matter expertise into our firm, that work with practices, that understand the challenges of change in a practice, right? Because once you've had a process for 10, 20 years and MedEvolve or any other company kind of walks in the door and says, hey, we're going to change everything. Naturally, there's going to be an aversion to change. So we have to be able to demonstrate, why we're doing these things, right? And what the ROI is because of those changes that will be made. That goes back to things we've done with other practices we work with and being able to demonstrate that to a new customer, and kind of try to build that rapport, with the front desk and trying to demonstrate like this will help you in your job. We're not making change just to make your life hard. We're making change to make the practice better, to make the experience better for the patient. I think just, again, it goes back to our people and us, excuse me, hiring the right SMEs to really go out to these practices that have experience in working with them.
And do you constantly have do you use any kind of training modules? Do you prepare any kind of training modules? Do you guys do anything which helps your company? Do you outsource your training? How do you manage it?
No, we do everything in-house.
Okay.
So really, for us, there's not really, I say, a module, because every practice is a little bit different and have different challenges. So again, I think it just kind of goes back to having folks in the MedEvolve team that have worked across specialties, worked with many different challenges, and usually we can draw upon that knowledge to really kind of just gain an understanding of the practice and again the challenges they're facing. And then we can draw on past experience and bring things forward that we know that are best practices that really do work, and we can prove it. So the other side of this is not just installing the technology or making the change, right? We have to be able to have the analytics on the other side to validate, that these changes are actually making an impact.
So you have a practice management system which is agnostic. You can work with any practice management system. Then you have your technology which sits on the top of it, right?
Mm-hmm. Correct.
And then you have people on the top.
Correct.
And all of this work together cohesively.
Yes.
Are you able to scale it?
Yes. Yeah. No. Like I said,
as for your expectations, like in last 20 years, as you said, it's a 20 years to startup.
Yeah. So, obviously we've built everything for ourselves. We have our own medical billing, business that does insurance follow-up and things like that. So we've really modeled our development cycles around having an incubator here in-house. So when we build things, we build them for ourselves. We try to reduce the amount of cost that we have in our billing business so we can make margin. No different than what a practice does. Right. So, we really, try to take those things that are valuable to us and roll them out and offer them to customers. And kind of getting back to your scaling question, we've built everything to start off in the MedEvolve environment, right? We know that there's tens of other PM EMR systems that are out there. We believe in talking to our prospects and clients is that a lot of our other competitors that are out there on the practice management space don't really have good work drivers, good workflow automation that's out there, right? They have pivot tables, they have some queuing systems, those types of things, and that may work fine for a period of time. But for you to really scale that business, to the next level, we have to be able to draw EBITDA out of that business. We have to be able to force multiply you, right? So you have 5 billers in the office. We want to make them do the work of 7 or 8, out of those 5. So that's kind of where we focused on, is really multiplying the output of a workforce, which, obviously allows our business to scale. Looking at a client of ours that's trying to grow businesses and acquire practices, we want to allow them to scale as well, because it builds that valuation of that business. So
I know you have a very interesting background of accounting and reporting and compliance. And so tell us a little bit about how we can, we have a lot of medical billing companies who are going to watch this show, right? Yeah. We want to know how, in simple steps, we can, implement those kind of things in our company. Yeah. What are the things we need to know if we plan to go public or want to scale it? What are some of the ideas you want to give?
Sure. So So one of the things I think is interesting is being a trained accountant, you're always kind of living in the past,
Right.
right?
Numbers, data again.
You close your books, you get your financial statements, and you look at them, and they're for the prior 30 days of the prior quarter. Anymore, we can't live like that. Decisions have to be made in real time or near real time. You have an issue at the front desk, or you have an issue in AR, or you have an issue in payment posting, or whatever that might be.
It should show up on the paper.
You have to fix it now.
Yes.
If you wait till 15 days after month end, you're 45 days behind the problem.
Yeah, but sometimes what happens, so like I talk to my doctors all the time, and they say, oh, if it does not break my bank, I'm not worried. I'm only worried about the things which breaks my bank.
Yeah, well, it may have broken your bank 45 days ago, and you just don't know yet.
And he's not aware, probably.
Exactly. So we want to be able to bring issues to the surface in real time as much as we can, so that when you're sitting down, not at month end, but over your morning cup of coffee and looking at your practice, and our analytics want to tell you the story, bring those things to the surface, not have you running pivot tables or having your accountant send you the ATB at the end of the month. There's some value there, but it's not nearly as valuable as having those data points real time. So you can say, I have an AR problem today.
Right.
I don't have an AR problem that I've just discovered 45 days after I have a problem. So, again, we want to really try to bring data and analytics and information that's actionable to the surface.
That comes for yourself, or it goes to your clients? These doctors, do they understand?
Again, we develop things for ourselves first.
Right.
It's about how we've always done it. So if we've created it here to manage our billing business, our providers can use it as well.
But for us, you don't think that we as billers, and I consider myself also a biller, we get the data already from an existing practice management system. So we kind of know it. It's the interpretation of that data too needs to be simplified.
Yes. So data without context is not worth much. Right.
But we know the context though.
Right. But we want to bring that context to you in a storied format that tells you, doctor, you have an issue
right there
in the operations of your RCM. So again, it's somewhat nuanced, but what we've seen in the marketplace is there are a lot of report generators and pivot table running and all these things that take time. We want to give that to you on your fingertips.
Correct.
So you can
that's a marketing side. That's a customer side. Absolutely. I mean, any company who would do that, they would come up with some kind of idea, solution to solve it, and hand over it to the customer. How do we equip our company, and from the accounting perspective, reporting perspective, where I'm guessing you guys are aiming to take the company to public at some point, don't you?
I would love to. We're probably not quite there yet.
Or institutional capital, or what's the goal?
Yeah, absolutely. No, I mean, look, I think anybody that's wanting to raise capital, valuation of your company is going to have a massive impact by your EBITDA.
Correct.
Right. So as a medical practice, if you're looking to seek capital from private equity, or you're out, trying to sell your practice to a larger system, whatever that is, they're going to look at your EBITDA. That's their, outside of your growth on your top line revenue, they're going to look at, how much margin you're getting out of your business. Right. So, for us, where we seem to be attractive to those private equity backed groups, is that we can consolidate operations. So if you have 5 practices that are joining together and you want to create a centralized billing office for that, and you have 5 different practice management systems, we can help you scale that business, using some of the software tools that we've developed. And not to mention on the financial side. So if you have 5 different practice management systems and you're getting 5 different reports with no way to consolidate those, you're going to have a hard time kind of managing across those 5 businesses. I think naturally providers want, and their practices, whether they're in a big group or not, want to operate somewhat autonomously. But you still have to have that management layer over the top at the CBO level or the MSO level. And we can help provide some of those things. Fantastic.
How's so what's your immediate goal, or maybe next 2-3 years? How do you foresee this business? Because it's RCM, people, processes, technology. How do you
Yeah.
see this whole thing? What direction they are going to?
Yeah. So, one of the big things that we kind of see is I wouldn't say it's a forgotten space, but maybe just not as targeted, is the collaboration space in healthcare. So within our EIQ suite, within the workflow management piece of that in particular, we see a lot of underutilization no utilization of collaboration tools, task management tools, those types of things. So trying to put this in a kind of more simple perspective is a lot of things are done by email.
Right.
And email is not
CRM space. CRM
Yeah.
space
Yeah.
for
Email
health.
is not trackable. Email is not accountable. There's no reporting that could be done. There's no structured data that's tying a email to a particular claim that needs to be managed. So what we've built out is more of again, the work management side of things, but also the messaging and tasking and collaboration around those claims. And again, how we hold our staff accountable. So if I ask you a question about getting medical records about a certain claim and I task it to you, I want to make sure that I can look back and say, yes, that has been answered timely. And if it hasn't, somebody needs to be alerting me.
Finger pointing is easy that way.
Say again?
Finger pointing is easy that way.
Yeah. Well, yeah. I mean, again, it doesn't.
You did this.
We talk about, taking conversations with an employee or with a doctor or anybody.
Transparency,
really.
more transparency.
Yeah, it's objective. There's no subject. We try to take the subjectivity out of the conversation, saying,
right,
you did not answer, and here's when I sent it. Here's what I needed. This was due on this date, and it's still sitting out here. So there is no, well, I sent you this email and I missed it, and all these things. All that goes away because we are keeping all the messaging and tasking and collaboration in a single spot tied to a claim.
So one of the very interesting things you mentioned in the very beginning of our conversation, and I'm intrigued about it, that who is paying for it. And I tell this to all of our healthcare startups whenever I get a chance, that this has to be determined very clearly. So in your case, how do you determine and how do you see your reimbursement model changing? Because I'm guessing all billing companies, they work on contingency model, right? Mm-hmm. Now, with the introduction of tools, technology, new innovations, it's an added cost. Mm-hmm. How do you guys package all of this to your doctors, to your clients? What's and is it going to change, or how do you see yourself, shaping up in this particular reimbursement model area?
Mm-hmm. Yeah. So, a lot of it just, I guess, in our industry is, either a percentage of collections, like you said, or it's some type of a per provider model is typically how things are priced. Right. Where we've seen a little bit of a shift, and this has really come along with how the workflow piece works, because some of the results in terms of cash recovery and things that we've seen with some of our clients that have utilized it, is that we've actually done a few deals where it's incentive based or almost success fee based.
Oh, wow.
So to where
did it work just like a collection company?
Yeah. So it's more is if there is a net revenue improvement, Medival would have a percentage based on the net revenue.
On top of the basic fees we are charging.
Right. So again, more of a not just we're going to charge you for every dollar that's brought in. It's based on the results that we either have demonstrated in ROI, right, and then executed on. And again, if we're increasing net collections or net revenue, mm-hmm, several percentage points above benchmark, could be hundreds to millions of dollars to an organization. Right. Just that single 2 pennies more on your dollar can really make a huge difference.
Do you guys use the offshore staffing?
We do not. We're a little bit say maybe unique in that respect, and there's 2 reasons for that. One, I think I alluded to before, is that we are our own incubator.
Right. Oh, so you have enough talent in-house in your office. How many people do you have in your office?
Yeah. So again, we build our products for ourselves first. It's part of our development life cycle and how we bring things to market. Which, having our own staff here onshore in-house, we can interact with them a lot more as we bring, new product, through the development process, mm-hmm, and get that feedback from them in real time. When you don't own that staff, it's a little bit more difficult to do that.
That's right.
And the second thing is just, for me, it's just, I love being a
hands-on.
job creator
Obviously,
here at home.
right.
We have, I think 75% of our staff are here in Little Rock. We have staff, the remaining 25% out in other states.
Right.
But again, I just being
how do you see after post-pandemic this whole thing is changing now?
Yeah, it was really interesting. So somewhat serendipitously, we had developed the workflow tools prior to pandemic. And I remember having the discussion with the board of directors, mid-month, March of 2020, saying, hey, look, I don't really know what's going to happen here. I don't think really anybody did, but we are taking the company 100% virtual. And because we had these tools in place, we went virtual in less than a week. So that was, 59 staff, I think at the time, that were either in office or, a very few actually that were remote at the time, and moved everybody out to work from home. So again,
but you don't have any problem hiring good talent, whether they're working from home.
Oh yeah, no, we do. I mean, we're no different than any other business out there right now. The difference is that we don't have to be tied to our geographical area. So we can hire in Montana or New York City or wherever you want to go. So, again, another kind of a value proposition for using workflow and being able to do the work from home model, I guess you could say, is that if you're in it's called a high rent area of the country, you're in California or New York City or anywhere like that, and you want to find talent outside of state, that may have a lower wage base, we can help facilitate that by some of the products that we have.
Well, I'm very excited, I think, and we have over 40 people live, so this is fantastic. If anybody wants to have a question for Matt, we can take up some questions. If not, I think we are going to see Matt and another Matt who works for the same company at our Healthcare Innovation Workshop on March 30th, 31st in New Orleans. You can register at www.hbma.org. And with this, Matt, I would thank you very much, and I hope to see you soon.
Okay. Yes, thank you very much for having me on the show today, and hope to be back sometime.
Thank you. Fantastic.
All right.
Wonderful. Thank you, guys. Thank you for watching another HBMA Live. And next Thursday, before I go, I would announce we are going to have few guests who would be presenting in New Orleans. So you would see them speaking next Thursday, talking about their workshop, their subjects, what they are going to talk about. And my friend Brad Lund, who is the new executive director of HBMA, would be hosting next session. So with this, thank you very much. I will look forward to seeing you again.